able to present the results for the delivery optimization for antiretroviral therapy study, or the DO-ART study. And this study was quite exciting because it tested whether very simplified HIV testing, ART delivery, and monitoring methods could overcome barriers that clients experience when they try to access clinic-based care. So we offered HIV testing in the community through mobile vans or at home, and people who are living with HIV could start ART in the community, either at home or in the mobile van. We followed standard clinical algorithms, and people were able to start ART if they were eligible within an hour, and then collect all their medication refills and conduct monitoring from the mobile vans, which we did quarterly. And this really increased access to care for participants. And we found overall that participants who accessed care through the mobile vans were more likely to be virally suppressed. And for men, the relative increase in viral suppression was almost 40%. So so viral suppression increased from 51% to 72% overall for men. And this result is really encouraging for us to think about how just simplifying the way people can access treatment can increase the health benefits at population level. One of the nicest insights from the study is that we can offer people living with HIV decentralized care from the beginning. We used to want patients to come to the clinic and have several visits and demonstrate that they were virally suppressed. And the 6 months to a year of multiple visits, I think, took a toll on the time and space that people had to engage in care, especially if they didn't have symptoms. When we offered treatment through the mobile vans compared to the clinic, there were no differences in viral suppression by gender. So women and men achieved the same viral suppression. So I think one of the main messages is we can make things simple for patients, and we can do that right from the start. Yes, so we did this for the general population, men and women living with HIV, but we know that there are priority populations for whom we have not done as good a job of increasing their access to antiretroviral therapy. So for men who have sex with men, injection drug users, commercial sex workers, all these important populations for us to access could benefit also from decentralized care. So they could also receive very simplified delivery of HIV medications and monitoring and refills that meet them where they're at. When we make it easy for our patients to access care, we really improve their ability to take daily medications and free up time and space also for clients to meet their daily needs and focus on their own lives. The other important advice for physicians from the study, participants reported that they really loved how accessible the study team was. So even though we only provided refills every 3 months, we were available via text message and phone. So if they had questions, they could reach out to us and we could respond to them quickly. And I think this is really one of the main modalities that we were able to that allowed us to successfully deliver treatment, because people could have their questions answered quickly and then get on with their daily lives. I think a lot of the lessons learned from this, including providing treatment in the community, freeing up clinical space for patients who need provider attention and who are more severely ill, and being able to communicate via text message or video conference and be able to deliver medications out in the community are valuable lessons for the COVID-19 pandemic that we are dealing with currently. So I would encourage everyone to think about how we can really simplify what patients need to do to access care and how we can provide it while keeping our facilities for patients who are more acutely ill.